If you care about your manhood, this video is meant for you. I'm Dr. Nancy Starr, urologist and pelvic surgeon, and today we're going to discuss 10 things you should never do to your penis. Guys, I'm a urologist, and part of my work involves looking after penises. And honestly, I care deeply about penile health, and you should as well. In this video, I'm going to reveal 10 practices you should adopt for your penile health that you probably weren't aware of. And make sure you stay until number 10, because that one's really going to shock you. Now, before diving into the content, I want to ask you fellas a big favor. If you've been following me for a while, watching my videos, please ensure you're subscribed to the Dr. Nancy Starr Men's Health channel. And if you're already subscribed, hit that notification bell. I create content regularly on this channel, and often you can't keep up because life gets busy. But I don't want you to miss out on valuable education. I notice only about 20% of viewers are actually subscribed. So please, do me a favor. Subscribe now. Share this channel with your buddies if possible, because it truly helps spread the message and support men worldwide in getting the knowledge they deserve. Number 1 is straightforward. Don't overlook your penis. Many of you may not know this, but how your penis performs acts as an indicator of your general well-being. When men begin experiencing erection difficulties, and you track them for 7 years after the issues begin, 14% end up suffering a heart attack. That's why we label erectile dysfunction the canary in the coal mine. But I always explain it's a signal of health, because strong, reliable erections and solid libido reveal a lot about your system. Namely, you have solid circulation. Your hormones are balanced. Your nerves are operating properly. You're mentally in a good spot, right? Stress isn't overwhelming you, and you're not using something harmful that's impacting your penile function. That leads to number 2. Don't experiment with homemade fixes for your penis. I've witnessed everything, and trust me, no home treatment exists that's going to safely make your penis longer or girthier. No mixture will cause overnight growth, regardless of what promotions claim. I recall an ad where someone applied apple cider vinegar to their penis claiming instant growth, and I thought, that makes zero sense. But I get the urgency around penile issues. Men desperately want solutions for concerns like size or erection quality. Often these methods lack evidence, pose risks, and can lead to damage. Here are some cases. 1 is Jelqing. Jelqing involves men using their hands with firm pressure to stretch the penis, aiming for extra length. The issue is, frequent overdoing it creates micro-tears in the penis over time, damaging tissue and potentially causing erectile dysfunction. Ask any urologist. We've all treated young men who jelqed excessively. Guys, you know how it goes. If I recommend something beneficial, you'll go overboard, not halfway. You'll push too hard, injure yourself, and risk permanent harm. So please avoid it. Another example is men using homemade constriction rings. In my constriction band video, I described a guy who placed a hardware nut around his penis, requiring the fire department's ring saw to remove it in the ER. Guys, this is real. He was likely intoxicated when he did it and blacked out. By arrival, his penis was massively swollen, no chance of removal without help. Another used a cut plastic soda bottle ring that got lodged. It's simply not worth the risk. Purchase a proper constriction band. You can find safe ones for around $20 on Amazon. They're designed for easy, secure removal. Number 3, maintain hygiene. Most know they should keep the penis clean, but with foreskin, men sometimes skip retracting it fully, cleaning underneath, or drying properly, leading to balanitis, infections of the foreskin that cause discomfort. Always take time to retract the foreskin, wash underneath, and dry it. If retraction isn't possible, that's concerning. Penile cancer is extremely uncommon, but cases occur where inability to retract hides the area, allowing cancer to develop unseen. I always advise ensuring you can retract fully. If not, consult your urologist or physician. It might resolve with steroid cream, stretching tools, or circumcision in some cases. The goal is always retracting, cleaning, inspecting, and returning the foreskin. Similarly, steer clear of harsh scrubbing. Some use heavily fragranced or potent soaps that irritate the sensitive skin. The penile skin isn't built for rough treatment. Just let mild soapy water flow over it. Prevent smegma accumulation and stay hygienic, but avoid vigorous washing or rubbing. It can cause redness, irritation, or even small tears. Number 4. Never dismiss discomfort or red flags. If something seems off with your penis, see a doctor promptly. Don't brush it aside. It might indicate a sexually transmitted infection, a urinary infection, or blood in urine signaling kidney stones, bladder issues, or worse, cancer in the bladder or penis if there's an ulcer or sore. Guys, don't delay. I know it's tough to expose yourself to a doctor, feel exposed, explain details, and worry about judgment after unprotected encounters. I get it fully, but your health comes first. If a doctor makes you feel judged, switch providers. Our aim is your safety and wellness. The most heartbreaking cases I've handled involve men ignoring penile sores until penile cancer advanced. Penile cancer is highly aggressive and very uncommon. I've seen only a few in my career, but when it strikes, it's frightening and life-altering. Often because fear delayed action. Early intervention means far less invasive treatment than waiting. Number 5. Stay in charge and practice safety. Nothing beats the thrill of protected sex. When you're with a partner without STD or pregnancy worries, you can relax completely, be open, and enjoy incredible intimacy. Always put safety first. Plenty of condom varieties exist. Try different ones to discover your favorite. Thinnest, most comfortable, best sensation. Involve your partner in choosing, but never skip protection. On safety, also emphasize control. Why? Vigorous activity can cause penile fractures. During intense sex with an erection, if it bends sharply, maybe missing the mark and hitting the pubic bone, you risk fracturing. This is a medical emergency requiring ER visit and surgery to fix the tear in the tunica albuginea. Delaying allows scarring, and roughly half develop erectile dysfunction later. Better to get prompt surgical repair for preserved function. You'll recognize it. Loud pop, intense pain, rapid eggplant-like swelling. Control matters. Grasp your partner's hips to guide speed and angle, preventing mishaps and protecting erection quality. Lubrication helps hugely. Lube enhances pleasure, reduces friction, and adds fun. Lack of natural wetness isn't a flaw. It's common with age, menopause, medications, or other factors. It doesn't reflect arousal levels. Number 6. Avoid overheating it. Keep your testicles in a cooler state. Testicles descend outside the body, unlike ovaries, for optimal sperm production temperature. Excessive warmth from hot tubs, saunas, or similar can impair sperm quality, fertility, and possibly testosterone. Limit such exposure. When using laptops on your lap, place a barrier between device and genitals. Store phones in back pockets, not front, as they generate heat affecting testicular function. Number 7. Treat it gently. When masturbating, avoid rough handling like death grip syndrome I've covered. Aggressive, tight grips during solo play create desensitization to normal stimulation from partners. Vaginas, mouths, etc. can't match that force. You may struggle with arousal or erections in partnered sex due to adaptation. Be gentle. Mimic partner-like stimulation. Add lube. Focus on enjoyment. Avoid rushed, shameful sessions in secrecy. Number 8. Quit smoking and prioritize wellness. Smoking destroys erections, 100% linked to erectile dysfunction. Avoid it. Smokers face higher bladder cancer risk, one of the toughest cancers with frequent cystoscopies and major surgeries that alter life. Lifestyle hugely impacts penile health. It's not flashy or instant, but crucial. Recall number 1. 14% of men with ED face heart attacks within 7 years because ED signals vascular issues. Healthy habits preserve erections. Eat nutritiously. Limit excess alcohol or drugs. Exercise consistently. Aerobic for circulation, weights for testosterone. Start small with tiny, unbreakable habits. I recommend the book Atomic Habits, link below. Apply its principles for lasting change. Also, reduce chronic stress. Some stress motivates, but ongoing stress harms libido and erectile function. If stressed constantly, explore ways to manage it and boost life quality. Number 9. Show yourself compassion. Men with penile issues often beat themselves up harshly. Worrying about performance, appearance, or pleasing partners creates anxiety that worsens problems. One failed erection leads to overthinking next time, spiking stress and blocking function. Vicious cycle. Be gentle with yourself. Erection variations happen to everyone. Occasional issues don't doom you, it rebounds. Avoid self-criticism and spiraling negativity. Men rarely discuss this, worsening isolation. Number 10. Use it or lose it. Does the saying hold truth? Partly. Some stop sexual activity due to erection struggles, embarrassment, or partner disinterest. But lacking erections, even nocturnal ones, becomes problematic. Nighttime erections, 3 to 5 normally, oxygenate tissue, preventing fibrosis or shrinkage. Without them, penis may shorten or feel firmer from scarring. Low libido, often stress or hormone-related, reduces drive further if ignored. For relationships, intimacy suffers. Sex offers huge benefits at any age. Effort from both partners matters, not constant but meaningful connection. Check my video on how sex might extend life if you missed it. And as always, take care of yourself. You're worth it.